Robin. I'm Joe. I'll be your nurse today.
Hello.
So you're getting your flu shot today, are you?
Mm-hmm.
Okay, and how are you feeling? Are you ready?
No, not at all. I do have a really bad fear of needles. I'm
Okay.
really anxious about this.
Yeah. Okay, so I'm just gonna get you to come lean towards
you think
me
there's
here.
another way we could do this? Like another time?
Honestly, I don't really have time for this right now. I've got about 30 other patients outside. I just did a
Oh.
baby and they had no problem with it.
Okay.
So can I
I'm
just
not
get you
too
to bring your
comfortable
arm
with it.
down on here?
Okay.
So just over here, yeah.
No,
Yeah.
I don't think
Yeah. Come here. Yeah.
No.
Yeah.
Stigma is something that 1 in 5 Canadians who experience a mental health problem throughout their life may face. Stigma is a negative attitude society may have towards someone experiencing mental illness. This negative attitude contributes poorly to the feelings people with mental illness have and often promotes a sense of fear, hurt, humiliation, guilt, shame, devaluation, and hate. Stigma also includes avoidance or avoiding something that we don't understand. Stigma is something that people with mental illness face daily. Many people experiencing mental illness report stigma and prejudice of the illness, and that these remarks can be as bad as the illness itself.
Is a concept that's easy to judge when you don't understand it. People who suffer from mental illness may inadvertently attract attention to themselves because their behavior is atypical from the norms of society. Sticking out of the crowd isn't bad, it's just different. People stigmatize a person with mental illness because they don't understand that individual's reality. That middle-aged man is weird because he's crying at the fact that he's getting a needle, and that woman over there is talking to someone who isn't even there. But people wouldn't bat an eye if these were children. Being scared of needles and having an imaginary friend are considered abnormal for an adult. We don't really know about what those people are experiencing. The human perspective is built by putting stimuli together to create a big picture, and who's to say that we don't all build the same picture the same way?
It is important to be aware of your own attitudes and stigma regarding mental health in order to avoid making judgments and prejudices towards certain scenarios and human beings. Also, by being aware of our own and others' attitudes and stigma, we are at a better chance of understanding the issues and disadvantages people face. We need to acknowledge the fact that people with mental illnesses are entitled to the same rights and opportunities as everyone else. Also, by being aware of our own attitudes and stigma, we become more aware of these negative attitudes within our community and are therefore able to educate others on the importance of avoiding stigma and prejudices towards those with mental and physical illnesses and disorders. A way in which we can address the issue and become more aware of our attitudes and stigma towards mental health includes seeing people as unique human beings, not as labels or stereotypes. See the person beyond their mental illness.
Stigma is very pervasive in our society, and it is the reason why so many people with completely treatable conditions suffer needlessly. Stigmas can act as a barrier to people seeking help. The way people with mental illnesses are treated can affect the ways in which they go on to live their lives. Reducing the stigma associated with mental illnesses will help people better recognize mental illness and be more equipped to avert harmful acts, as well as help those who struggle with mental health to obtain the best help and treatment. Stigma is the result of a failure to understand behavior, appearance, or communication in a way that causes the mistreatment of someone due to not being perceived as normal. If we are better equipped with an understanding of why someone might be behaving, communicating, or feeling a certain way, we'll be able to treat them in a way that does not ostracize them, but rather embraces and supports them. Reducing stigma in mental health will show people that mental illness is no different than physical illness and that there's no shame in seeking help.
As students completing the comprehensive Bachelor of Science in Nursing degree, we are taught the holistic view of nursing in that we should be treating each patient as a whole person rather than simply a list of symptoms. Bringing awareness to mental health concerns and reducing stigma are products of this approach, as we are recognizing more and more that mental, spiritual, emotional, and physical aspects all interplay in a person's response to treatment and their attitude towards their own healthcare. Students are responsible for bringing what they are taught in the classroom into their practice, and the understanding of mental health helps us to treat our patients with more compassion, empathy, and acceptance. Rather than just learning the how of giving a needle, for example, we need to understand that the person we are giving the needle to is a human being with complex emotions and fears, just like those we have ourselves. If we take the time to listen to the needs and concerns of our patients, we can deliver safer, more competent care and better the experiences of all people who we come across in our practice. Nursing students have a responsibility to lead by example, sharing what we know and what we have learned to prevent stigma from causing the belittlement or isolation of anyone with a mental health condition of any kind. Examples of this could be taking the time to listen when a patient, or anyone for that matter, needs to talk. Sometimes feeling heard is all someone needs. Checking your own beliefs prior to any encounter and understanding how your worldview could differ from someone else's. Choosing your own words carefully and understanding the impact those words can have. And not being afraid to stand up and speak up when necessary to educate those around you when you encounter someone engaging in stigma. It only takes one person's voice to make the world of a difference.
Hey Robin, my name's
Hi.
Joe. I'm your nurse here to give you your flu shot today.
Okay.
How are you feeling?
A little uneasy. I do have a pretty big fear of needles, so I'm kind of uneasy right now.
Okay,
Not
well,
sure how I feel
first thing
about
I
it.
want you to know is it's totally normal.
Okay.
So many people are scared of needles. It's just not something that we're used to getting
Okay,
pricked all
that's
the
good
time.
to know.
Yeah. Is there anything that anyone else, like, have you had shots before?
No, normally they're not really too good at giving them, so I just end up not normally getting them and just leaving them.
Okay, so let's start things off on the right foot then.
Okay.
How about we do some deep breathing? Just kind of calm the mind a little bit.
I think
So
that's a good idea.
inhale through your nose for me, and then exhale through your mouth. So we're just gonna keep breathing like that until we're done here, okay?
Okay, that's helping.
And I'm
me.
also gonna give you this little stress ball. If you wanna give that a squeeze with your hand that we're not gonna be doing the needle with. And then do you wanna just bring your arm towards the chair for me? Thank you. So we're just gonna get this ready. So are you in school or anything?
No, not yet.
No?
Nope. I'm just doing life.
Yeah, so you said not yet. Are you thinking about going into a program?
Yeah, I'm thinking of doing film.
Film? Oh, neat. What kind of movies do you like? I'm just gonna wipe your arm here, okay?
Okay. I like all sorts of movies, mostly comedies.
Comedies, yeah? What's your favorite comedy?
Every single movie. I'm a big fan of movies, so every
Yeah?
single movie I love.
I personally really like Will Ferrell. He's pretty funny.
Oh,
Okay, so
yeah,
just
me
hold nice
too.
and still for me, okay?
Okay.
So, tell me, have you gone to see any movies lately?
No, not at all actually. I haven't been for a long time.
Okay.
Yeah.
Perfect. And look at that, we're done.
That was really
That-
good.
that
Thank
wasn't
you
so
so
bad,
much.
eh?
No, that was the best needle I've
Oh.
ever received.
Awesome.
Thank
Well,
you
I'm
so
glad.
much, Nurse
Thank
Joe.
you. Do you have any questions for me before you go?
No, I don't think so.
No?
I think that went pretty good.
Okay, well, perfect.
Thank you
You're
so
all
much.
set. Thanks. The image reflects the point of view of someone who is experiencing a panic attack due to a phobia of needles. This is because we've blurred the edges and exaggerated the gauge of the needle, making it the center of focus just as it would be to someone experiencing this phobia.
The blue and white overexposed lighting symbolizes a clinical setting that would feel cold and unwelcoming, which fosters the feelings of anxiety in a patient with a phobia of needles. The presence of the shadow is menacing and ominous, further representing the severity of the fear associated with the needle.
Our quote is a stigma in itself. It is a direct example of a belittling remark said to someone panicking in fear from getting a needle. These kinds of remarks stem from unawareness about the extent to which a phobia can control someone's actions. It's not theatrics, it's psychological, and it's not just something you can relax about. It's important to note that anyone can be subjected to developing a phobia.
We have dramatized the effect of the needle to tie into our quote. The needle's size is exaggerated to show that what somebody might see as theatrics is actually a psychological response to a stimulus, and that this should be taken into consideration while providing care. By understanding the psychological and physical effects that a phobia can have on a person, we can better handle patient interactions to create a safer and more accepting environment for our patient, as well as being able to deliver more competent and efficient care ourselves as practitioners.